Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about classification of soft tissue injury. In previous video I have explained clearly of soft tissue injury, what are soft tissue injuries and mechanism, direct trauma, indirect injury, and approach of patient with soft tissue, how to deal with that patient, and goals, what are our goals, and treatment. I have explained clearly. In this video I am going to explain clearly about classification of strains, what is strain, and what are the severity, how much degree in primary one, first, secondary degree, third degree, and fourth degree, and treatment, clinical features and treatment. I'm going to explain clearly once understand this topic. So let's start our video. First of all, what is strain? Strain means that injury to muscle and tendon. Why this strains occur means due to sudden or abrupt action. Abrupt means unexpected action, sudden or unexpected action that leads to this strain by direct trauma, direct accidents, or over by stretching of muscle in sports people. Okay, and what are the types in this strain? They are acute strain, chronic. Acute means mild, and severe strains. Severe. Okay. Now acute means a sudden violent force or direct hitting, direct trauma. Chronic means due to injury since long period and leading to ischemia, means loss of blood supply. Due to that long period there will be loss of blood supply, and muscle fibers also are muscle fibrosis also is seen. Okay, now severity, injury, they are divided into primary, secondary, tertiary, and fourth degree. Okay, these three I am going to explain. First one, primary strain. First one, primary strain. See, primary strain, secondary, how some muscle fibers are torn, and this is complete removal of the complete break of the muscle. Now we'll read primary strain. Here few fibers are torn, means are ruptured, and bleeding is minimum bleeding is seen, and fascia remains intact. This fascia means that the thin connective tissue that surrounds and holds every organ like blood, muscles in correct place. Okay, this is fascia that remains intact, means in same position, means not damaged much. And clinical features. What are clinical features? Means there will be pain and tenderness. So due to pain and spasm, there will be prevents stretching. They are unable to stretch. Okay, due to pain and spasm. And functions are not impaired. Okay, that any functions they'll do any functions. The functions are not impaired. So primary strain only, there will be mild. Cryotherapy, we need to give first aid cryotherapy for 20 minutes and gentle active muscle stretch for 20 to 1 hour. Now compression bandaging with optimum pressure, and low dose and low power of ultrasound helps, and gentle massaging of the surrounding area also helps. So if the pain is minimum, decreases, patient can do light work for the next day. They can do their work. Now this is primary. Now secondary, we'll see. Here gentle, greater number of muscle fibers are torn, means a break, and more bleeding is seen, and fascia still remains intact, means not damaged, and hematoma still is localized. Hematoma means swelling and clotted blood within tissue. Okay, now in this the clinical features are pain is more severe than the primary one. Now muscle fibers, severe muscle spasm is seen, and patient unable to move the limb. Okay, now in third strain means large area and greater number of fibers are torn, muscle partially torn, and muscle group also is involved. Bleeding is widespread and more, and bleeding is intermuscular and intramuscular, inside and outside. Severe pain and loss of the function is seen in this. Now in fourth degree there will be complete tear of muscle, fascia is torn, and gross swelling is seen. Okay, bleeding also is seen. Okay, now next clinical features in this severe pain with loss of function. Okay, now treatment. In this secondary strain and third strain, there will be same treatment. First 24 hours we need to give immediate icing and compression bandaging we need to give. Next, limb elevation, limb lifting, and if there is a limb immobilized in splint, if there is more damage, more tone, so limb immobilized with splint to remain in fixed point. Isometric to the muscles which is immobilized, and active exercise to the unaffected limb. So unaffected limb joint we need to give active exercises we can give for unaffected limb. Next, during 24 hours to 48 hours, this bandage is removed and active muscle exercises are begin. Now stretching within the limb, thermotherapy like ultrasound is shortwave diathermy TENS to helps to relieve pain. Now slow rhythmic massage helps to relieve the muscle spasm, and non-weight bearing crutches is slowly started and partially. Next, after non-weight bearing we need to give partial weight bearing can be permitted. After 72 hours, all the above exercise are to be given vigorously. Active movements like isometric need to give, and limb elevation, these all, and totally bandage is removed, and progressive resisted exercise and full weight bearing and walk and jogging is suggested. Okay, I hope you understood this topic. Thank you for watching this video.